Hello everyone, welcome to this video session on the topic Forensic Science Laboratory. In this session, we will be just discussing a very few questions, that is 2 or 3 questions, regarding some interventions or some methods which will help in assisting the findings that we are interpreting during the time of postmortem or autopsy. So remember, forensic science is the study and application of scientific examination and evaluation of evidence for legal purposes. This forensic science includes forensic medicine, forensic psychiatry, forensic toxicology, pathology, immunology, anthropology, odontology, and forensic police sciences. Remember, forensic science laboratory is it's an organization, it's like an institution which provides lots of services like clinical services, pathological services, okay? And of course have museum which contain fingerprints, bullets, okay? And what about the staffing pattern? We'd have a director, a physician, a pathologist, laboratory services, and librarian, and a liaison officer. So what are the functions of a forensic science laboratory? To examine, compare, and evaluate the physical evidence, protection of the innocent, training of the police investigators as to what constitutes the physical evidence and how it is to be found, how the samples has to be collected, preserved, and delivered to the laboratory. Remember, forensic science persons or the personals or the staffs, they are the ones who actually go to the site of crime and they collect the evidences. Okay, it's not the civil surgeon or the police surgeon. Okay, it's not the doctors who is going, it is the forensic science staffs who goes. Okay, don't confuse this. It's a very commonly asked question during your practical viva. Is it the doctors, is it the civil surgeon or the police surgeon who goes at the site of crime, which is usually exhibited in the various movies? No, it's the doctors won't go. The doctors won't go. It is the forensic science experts or it is the forensic science technicians and the staffs who go there. Here I want to explain a very, very important terminology that is called Locard's principle of exchange. What do you mean by Locard's principle of exchange? When any two objects come into contact, there is always a transfer of material from each object on the other. Traces from the scene may be carried away on the person or the tools of the criminal, and at the same time, traces from all or any of these may be left at the scene. Whatever a criminal goes, whatever he touches, whatever he leaves will serve as a silent evidence against him. What are the examples? Fingerprint, footprint, hair, fibers from the clothes, etc. Broken glass, tool marks, paints, scratches, blood, or seminal stains. Okay, fine. Here I would like to explain a terminology called as corpus delicti. What do you mean by corpus delicti? Corpus delicti actually refers to the body of the crime, also called as the essence of the crime or the core of the crime, just for completion. Okay, once that is done, let us go for the two most important questions that will be asked from this chapter. One is lie detection using polygraph and narco analysis, also called as truth serum. And the second question is actually called as brain mapping or brain fingerprinting. Both are very repeatedly asked, very frequently asked question, and at the same time, students won't read this question. Okay, both in your practical exam as well as in theory exam, these questions are very frequently asked. So as far as lie detection is concerned, we have two entities called as polygraph and second one is called as narco analysis or truth serum drugs. Okay, first let us see what is polygraph. Polygraph is an instrument used to detect lies, and the most commonly used is called as the Keeler polygraph and Steeling's decipitograph. Okay, these are the two important name of the polygraph, which is nothing else but an instrument used to detect lies. So actually this polygraph is an instrument which will make a continuous record of blood pressure, pulse, respiration, muscular movements, and electrodermal reaction changes in response to stimuli in the form of questions. Here comes a question. In MCQ, I think last year in supplementary exam they have asked this question. Which of the following is not a component? Which of the following won't be measured by the polygraph? Okay, so remember, BP, pulse, respiration, muscular movements, and electrodermal reaction changes are being recorded by the polygraph. So actually, what is the principle? It is based on a theory that when a person tells a lie in answer to a question, there is a fear that lie will be detected, and the emotion of the fear results in stimulation of the sympathetic nervous system, which result in some certain physiological changes. And these physiological changes are called as psychosomatic changes or psychosomatic reactions, and these can be very easily recorded. What will happen? There will be a relative rise in blood pressure, pulse rate will increase, there will be slowing down of breathing, erratic breathing will be present, there will be suppression of involuntary muscular movements, and there will be lowering of galvanic skin resistance. Why there is a lowering of galvanic skin resistance? This is mainly because of the increased activity of the sweat glands. Fine. So here we have something called as pre-test as well as post-test interview. So in the pre-test interview, the test questions will be framed with the mutual consent of the subject and with the satisfaction of the examiner that they are adequate to serve as the purpose for the particular examination. Okay, fine. And an attempt will be made to answer the subject's question regarding the procedure, and the questions will be framed in such a way that they are clearly understood by the subject and they call for only yes or no as answer. Very, very important. It's just an yes or no question. We'll just ask a question and the patient won't be saying anything other than yes or no. Fine? Yes. And remember, a question is asked every 20 to 25 seconds and a polygraph chart is recorded in 3 to 4 minutes. And remember, an experienced and a competent polygraph examiner can correctly detect the truth or lie in about 80 to 90% of the cases. This is mainly useful in cases like civil cases like paternity cases, insurance claim, pre-employment screening by banks and other institutions. So this is how these are the things that you have to keep in mind when as far as polygraph is concerned. It's a very frequently asked question. Please read it thoroughly and remember the components. Okay, remember the components. Okay. Once that is done, let us see about what is called as narco analysis. See, narco analysis is otherwise called as truth serum drugs. Okay, that means we are giving some drugs, and as following that we are detecting the lies. So remember, as far as narco analysis is concerned, it is based on the principle that at a point very close to unconsciousness, the subject will be mentally incapable of resistance to questioning and incapable of inventing falsehood that he has to conceal his guilt. That means we will be giving some drugs. These drugs will be acting in such a way that he will be taken to a stage just before unconsciousness, not completely unconscious. See, what will happen if the patient is completely unconscious? See, if the patient is completely unconscious, just remember one point, but he won't be able to answer anything. Am I right? A completely unconscious person won't be able to answer anything to our questions. So, when we are giving the drugs, these drugs will be taking the patient to a stage just before the stage of complete unconsciousness. And what it is believed that at this particular stage, he will lose his resistance. Whatever we ask, he will not be able to, conceal the truth or the mistakes that he has committed. Fine? Yes. What are the drugs which is very commonly used? The truth serum drug of choice is called as sodium amytal. It is called as sodium amytal, also called as sodium thiopentol. Okay, thiopentol sodium. Okay, these are the two drugs which is very commonly asked. But remember, this procedure is not commonly done. Okay, as per the guidelines issued by the Honorable Supreme Court, these drugs cannot be used very commonly. We need special permission from the higher authority to do narco analysis. Okay, so what are the other drugs used? Scopolamine hydrobromide. Second drug is sodium amytal or sodium thiopental, and third one is called sodium seconal. Okay, sodium seconal. So these are the drugs that we are using. So sometimes all three drugs will be simultaneously administered. What will happen? The person will lose his inhibitions and become talkative. Okay, and he will lose resistance. Okay, he can't hide anything, and it will depress the CNS. BP will be lowered, heart rate will be lowered. In a stage of relaxation, he is susceptible to suggestion and reveals the repressed feelings or memory. Okay, yes. Remember, these drugs will remove just the inhibitions or the resistance, but not the self-control. Fine? Yes. So this is the, but remember, this administration of this drug is associated with a very high risk of hallucinations after the test. Okay, that is why, and as well as large number of false negatives are very common. That is why narco analysis is not done routinely. Okay, not done routinely as per the recent guidance issued by the Honorable Supreme Court of India. We need special permission from the competent authority to do narco analysis. Okay, fine, yes, because following this test, it will have serious impact on the central nervous system of the patient. So this is the second way of lie detection, and the third way is called as hypnosis, and fourth way is called word association, which are of least importance nowadays. Coming to the last part of this video, brain mapping, also called as brain fingerprinting. Here, what is actually, it is like how we are doing fingerprinting for DNA fingerprinting. Here, What is a technique which measures the recognition of familiar stimuli by measuring the electrical brain responses, okay, to words, phrases, or pictures that are presented on a computer screen. That means the LEDs, ECG, like is how we are connecting the leads for ECG. Special LEDs will be connected, okay, will be kept on the different parts of the brain, and images, pictures, words, phrases will be what depicted through a computer screen, and we will assess the various brainwave responses. Okay, when the patient is seeing these things or when the patient is hearing these words or phrases, how is his brainwave responses? Okay, all this will be properly recorded. It is based on theory, very, very important is the principle that the suspect's reaction to the details of an event or an activity will reflect if the suspect had a prior knowledge of the event or activity. You would have seen in many movies, okay, what the doctors will be saying, yes, okay, we will have, they will show a thumbs up or a thumbs down, okay, which shows that whether the patient already knows about that event which has happened or he is not, but he is unaware of that event. Fine. It uses a multidisciplinary approach which mainly involves brain imaging, neuropsychology, clinical neuroscience, computer science, bioinstrumentation to integrate information which ranges from a whole brain structure to a microscopic level. See, now this brain fingerprinting has gone to the level of AI, artificial intelligence. And here, what are the different, accessory or what are the different components of brain fingerprinting? We use something called as EEG, electroencephalography, magnetoencephalography, PET, MRI, functional MRI, and computer tomography, and the equipment called electrocap is fixed on the suspect's head for recording EEG. Okay, we are using something called as an electrocap. And suspected person is questioned about the crime and also shown the visuals of the crime scene, no? Okay, that is the victim, weapon, time, place, and how he committed the crime, etc., along with irrelevant words, photographs, etc., on a video monitor and a computer control, which will stimulate his brain and encourage a reaction on the computer monitor. Very, very important. Okay. And apart from his verbal replays, another computer keeps track of the neuro impulses emitted whenever the visual is seen. For example, I am just showing the crime scene, and another computer will be recording, okay, what are the different types of waves which are emitted from his brain. Okay, and a specific wave response called a murmur is elicited when the brain processes the relevant information it recognizes. Okay, that means when the brain is processing the relevant information, that a particular wave response will be obtained, and that particular wave response is called a murmur. Okay, it is extremely important, very commonly asked multiple choice question, memory encoding related multifaceted electroencephalographic response, also called as murmur, which is a specific wave response which is elicited when the brain processes the relevant information it recognizes. Okay, the murmur will be, so whenever the details of the crime the perpetrator would know are presented, a murmur is emitted by the brain, okay, of a perpetrator, but not by the brain of an innocent suspect. Okay, that means if that patient is aware of that event, then only the specific wave response called murmur will be emitted. In an innocent person, it will not be emitted. Okay, so this is the what you have to remember. And a very, very important question, as per the Constitution of India, no person accused of any offense shall be compelled to be a witness against himself. What does that mean? For example, I have committed a crime. Okay, so I know that I have committed a crime. Am I right? But what we are doing by giving the sodium amytal thiopental sodium using narco analysis, okay, I am making myself, okay, I am making a witness, okay, myself, I am turning into a witness, okay, that means I itself is giving evidence against myself. So as per the Constitution of India, okay, no person accused of any offense shall be compelled to be witness against himself. That is what we are taking him to a stage just before the stage of an unconsciousness, and we will be revealing all the truth following the administration of these drugs. That means I am giving some the evidences against myself. So as per Constitution of India, it is illegal. Okay, and in 2010, this narco analysis, polygraph, and brain mapping testing without their consent will violate the right against self-incrimination. Very, very important. That is why I have told you. Now, these days, it has become much more stricter. Narco analysis has all become completely obsolete. Okay, why? Because it's not commonly done. We are using other ways of other ways of lie detection, in the sense through investigations, okay, or through proper court trials. Everything only we are finding the truth, and we are not using narco analysis, brain mapping, or brain fingerprinting, okay, polygraph, everything, because it will violate the right against self-incrimination. Okay, and with this, I have come to the end of this video, and so in this chapter, the two important questions you have to remember is polygraph, narco analysis, and of course the last one is brain mapping, also called as brain fingerprinting. Remember, murmur is elicited only by the brain of a perpetrator and not by the brain of an innocent suspect. Fine.